Nearly 1 in every 2 Australians are currently suffering with a chronic healthcare problem. We have often few treatments available to manage these patients. This puts additional strain and stress on our healthcare system because it's really not set up and designed to deal with chronic conditions over a prolonged period of time.
The risk of not acting is seeing our healthcare systems overwhelmed by the burden of different chronic diseases. We can flip that though and say there is an opportunity to do something different, to think big and to really leverage the amazing capability not only across the Parkville precinct but with our partners and other organisations as well. My name is Laura Downey and I'm a professor in the Department of Optometry and Vision Sciences.
I'm Professor Stuart Mazzoni. I'm a Professor of Neuroscience in the School of Biomedical Sciences. I'm also the Deputy Head of Department of Anatomy and Physiology.
Our goal in the curing chronic disease area is to develop cures for high burden conditions that have global impact and really transform clinical care for people with those conditions.
Examples of chronic disease with a high burden include diseases like asthma, diabetes, blindness. And if we don't solve these problems, then the burden on our healthcare system will continue to grow.
We see this as an opportunity to reimagine how we tackle some of the world's most significant global health challenges, where we engage people across different sectors and different disciplines and come together with people with lived experience to drive innovation where our projects really have the opportunity for real-world impact.
The Curing Chronic Disease team here at the University of Melbourne is perfectly positioned to undertake these large-scale projects. We have incredible depth of expertise across a number of different disease domains. We're embedded in a world-class biomedical precinct here at the University of Melbourne, and that gives us access to incredible infrastructure to tackle these complex questions.
And it's by this different focus where we really come together, break down silos and work on the most important problems that we see the potential to have greatest impact, not only in Australia, but also with international reach.
If we get this right, I think the future looks really exciting. There's opportunities to train the next generation of researchers to ensure that they're addressing the needs of consumers and of the healthcare system. But most importantly, there's an opportunity to relieve the disease burden of some of our most difficult to treat chronic diseases, and in doing so improve the quality of life of patients, not just here in Australia, but across the world.